Hello everyone. So today we are going to talk about the cephalosporins. In the cephalosporins, these are beta lactams. We know that cephalosporin are used for gram-positive and gram-negative bacteria. Then, for example, we will not gonna discuss all the cephalosporins because it is too vast and not often asked in MCI. So that's why. So let's see. So cefazolin is a drug of choice for surgery prophylaxis, and in third generation of cephalosporin, like third generation is wide spectrum. So in third generation there can be cefixime or ceftriaxone or ceftazidime. These are mostly used in the clinical practice also. So these all cephalosporins, they what happens is they cross the blood brain barriers. So that's why we can use it in case of meningitis. Okay, now another one is ceftazidime. So this ceftazidime is a drug of choice for pseudomonas. Ceftazidime is a drug of choice for pseudomonas. Then if in fourth generation cephalosporin, there can be like a cefepime, then cefpirome. So these mnemonic, this pi is coming in fourth generation. Okay, then fifth generation there will be like ceftaroline, then ceftoprol. So these roll and roll in the names, they are coming in the fifth generation cephalosporin. Now basically cephalosporin is not effective against listeria or atypical mycoplasma or another one like Enterococcus facialis or Methylene Staph aureus. So by the mnemonic name we can remember it. Okay, one more thing is that as the cephalosporin groups are increasing, like first group, then second, then third generation, then fourth generation, then fifth, then sixth generation. So as the generations are increasing, what is happening that the spectrum as well as resistance is also increasing. Spectrum means we can use it in widely. For example, if like certain infection we gave to the patient like cephalosporin first group, suppose, but the patient is not treated yet, so we can just give another cephalosporin. Okay, so because maybe third one, because third one is like widely spectrum. Okay, that's why. Then another one is this one, that is the carbapenem. Carbapenem is also used in gram positive and gram negative, and also they can be used in anaerobes. Now carbapenem, they are most wide spectrum drugs. Okay, and carbapenem example like imipenem, then ertapenem, then ferropenem. These penem name na, so these are coming in the carbapenem. Now imipenem is basically metabolized in the kidney by an enzyme known as DHP. So because of that, what is happening, that it is producing a nephrotoxic metabolite. That's why what is happening, so it will be nephrotoxic to the kidney. So we never give the imipenem alone, we will always give the imipenem with the cilastatin. Why? So the cilastatin inhibits this DHP peptidase. Okay, so that's why. So in simple means we can just remember imipenem is given with cilastatin, that's all. Okay, then another one is the monobactem. In monobactem we know that there is single ring. Okay, and it's come under the name of like astrionam. Okay, and one important thing is that it is only beta lactam which use in patient who are allergic to the penicillin. Now another one is this one, that is cell membrane inhibitor. In cell membrane inhibitor there can be polymyxin. The polymyxin can be polymyxin B or polymyxin E, or they have the colistin in it. So basically these are used in pseudomonas, like P and P are coming together often. Okay, another few gram negative. Then another cell membrane inhibitor. See, we have talked about the cell wall inhibitors, right? But now we are talking about the cell membrane inhibitors. Okay, so now another one is daptomycin. The daptomycin, it is drug of choice for vancomycin resistant Staph aureus and also vancomycin resistant Enterococcus. Then the last one of this video is antimetabolites. So antimetabolites, these are the drug which affect the folate metabolism. Okay, so basically, for example, over here like in the antimetabolites there can be like sulfonamides. Okay, these sulfonamides is exactly the Actually, bacteriostatic. Static means which is inhibit the growth of the bacteria. Okay, so the example can be sulfadiazine, then sulfamethisol. So all the drugs which have, like most of the drugs which have the sulfa in its name. Okay, basically these sulfonamides group are like inhibiting the enzyme folate synthase. That's how it's disturbing the metabolism. Now in the uses, for example, sulfadiazine. Silver sulfadiazine is used in topical creams in the burn patients. Okay, then another one is like a sulfadoxime plus the pyrimethamine. This is used in the treatment of the malaria. Then another one is clotrimazole. Clotrimazole is a combination of this trimethoprim plus this sulfamethoxazole. So basically, as a combination, one name is this clotrimazole. Okay, so this clotrimazole is a drug of choice for the pneumocystic cerevisiae. Okay, this pneumocystic cerevisiae is often seen with the patient of the HIV. Okay, so that time we use this clotrimazole. Okay, then the side effect, there can be SLE and there can be kernicterus, means yellowishness of the child. Okay, infant. Okay, that's why these metabolites, these are contraindicated, means which should not be given in the neonates and the pregnancy. Thank you. For further information, I will make another video, and that will be last video for our this antimicrobial.